I think we really need to push more of our oncology nurses to get into elected and appointed positions. So often we're looking at health positions to get involved, and those are wonderful. We need nurses as secretaries of health, but there are others. We as nurses, we understand higher education. We understand environment. We understand energy. So I think we look broadly at what are positions we can get in. Let's have more nurses run for state legislative offices, for our House of Representatives, for the U.S. Senate.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between.
Hello and welcome to the ONS podcast. I'm your host, Ryne Wilson, member of the ONS 50th Anniversary Committee. For 5 decades, the Oncology Nursing Society has been at the forefront of advancing cancer care, not only at the bedside, but also on Capitol Hill and in state legislatures across the United States. In this special anniversary episode, we'll reflect on the pivotal moments when oncology nurses raised their collective voice to influence health policy, protect patients, and shape the future of cancer care. Join us as we celebrate these milestones, honor the leaders who've paved the way, and look ahead to the next 50 years of advocacy. This episode is part of our 50th anniversary podcast series. Join us each month throughout 2025 as we feature episodes exploring ONS's rich history and promising future. Today, I'm talking with 2 of our colleagues who have extensive experience in cancer healthcare policy. So first is Dr. Barbara Damron. Dr. Barbara Damron is a professor emerita at the University of New Mexico Health Sciences Center College of Nursing, where she is also serving as a visiting professor. She has served as Chief Government Relations Officer for the University of New Mexico. As the first person to hold this position, she oversaw all federal, state, tribal, county, and city government affairs for the entire University of New Mexico system. She has also served as the Cabinet Secretary for the New Mexico Higher Education Department and numerous other health and education-related public sector roles. Dr. Damron's earlier research has focused on cancer prevention and early detection. She is currently writing a comprehensive reference and policy book chronicling the history of higher education in the state of New Mexico and pathways for the future. Next, we have Dr. Janice Phillips. Dr. Phillips is the Assistant Director of the Illinois Department of Public Health, as well as an experienced clinician, researcher, educator, nurse regulator, author, and public policy advocate in the healthcare arena. Dr. Phillips is the recipient of the Martin Luther King Jr. Humanitarian Award, the University of Illinois College of Nursing SAGE Award, the National Black Nurses Association Lifetime Achievement Award, 4 Distinguished Alumni Awards, and others. In 2000, Dr. Phillips was inducted into the American Academy of Nursing for her distinguished contributions to addressing breast cancer disparities nationally and internationally. As Assistant Director of the Illinois Department of Public Health, she leads efforts focused on improving health outcomes across the state through establishing new and strengthening existing collaborations between the department and external community partners. Thank you both so much for joining us today, Janice and Barbara. I'm going to go ahead and jump into our first question. Looking back over the past 50 years, how has ONS helped the oncology nursing perspective evolve and become incorporated into cancer care policy at the local, state, and national levels? And what might be some examples of this influence? So Barbara, maybe I'll start with you.
Thank you so very much. ONS has truly helped oncology nursing evolve. Without the Oncology Nursing Society, we would be nowhere near where we are in oncology nursing. Many ways that ONS has done this. First and foremost, for me, is ONS has provided so many leadership opportunities for all of us who have been involved since some of those very early days. For me, that's involved chairing the ONS Foundation, leading one of the first big capital campaigns that we had. I also chaired the chapters committee and served on the ONS board. These positions really provided me with the leadership skills and connections I've used throughout the rest of my entire career. And by using these opportunities and these skills that I gained through being so involved with ONS, that's translated into my policy work at the state and federal level. And that's available for anyone who wants to get involved with ONS. Also, ONS has had an ongoing advocacy program. We've trained nurses on how to make capital visits. We've trained them on how to interact with state legislators. We take nurses up to the Hill in Washington, D.C. We work quite a bit keeping oncology nursing involved at local, state, and national levels. I know Janice will be talking about all the national advisory boards that we've been interested in putting people on. I've been successful with that in ONS. And many of us have been involved in scholarly publications, from peer-reviewed journals to books. So all this together has really worked to evolve the profession of oncology nursing and to set us up in a way where our voices are heard in an advocacy and policy way. I'll defer to Janice here.
Thank you. ONS has always been very supportive. I recall very, very clearly early on in my career, I was connected to some of the most stellar researchers, stellar nurse scientists in this country. I'm reminded of people like Karen Hassey-Dow and Victoria Champion. Those individuals helped me to advance my own breast cancer disparities research. And without them serving as pioneers and role models and mentors for me, I don't know that I would have progressed at the rate that I did. But it was just great being connected with people who were dedicated to research, who were open and willing to mentor others. And so that happened because of my affiliation with the Oncology Nursing Society. I would also say that ONS has done what I believe to be just a tremendous job in pairing nurses for Hill visits and helping them to take the message back home and to be stronger advocates. I have participated in a number of Capitol Hill visits with ONS. As Barbara mentioned, some of our ONS members have actually served on national advisory boards shaping national cancer policy. Dr. Sandra Underwood, Deborah Mayer, Karen Menenze, and Victoria Champion have all been in those roles, which are very, very competitive. But it's been great to see nurses at the table where those key decisions are being made. And then I can't say enough about the stellar publications that have come out of ONS, See John and the Forum and so many other books, including one that Barbara and I had the privilege of publishing through ONS on cancer and health policy, advancement and opportunity. So not only were there opportunities to present and to develop skills, there's also been opportunities for me to advance my scholarly portfolio. So I am totally, totally grateful for that.
That's wonderful. I really appreciate both of your all's perspective and kind of sets the stage for us as we keep talking through some of these things looking ahead, being able to reflect back on really 50 years of pretty impressive advocacy for a specialty nursing organization, and leaders like the both of you and those that you referenced and others has been, for myself, really inspiring. Such a privilege to be a part of this organization with such a long legacy and really shaping local, state, and national policy. So I really appreciate those perspectives. You know, I might also mention a few things our listeners may or may not know about from ONS's legacy in health policy and advocacy. For instance, ONS members have served on the Cancer Moonshot Blue Ribbon panel, as well as the clinical trials and dissemination work groups that came out of that panel. And ONS is also one of the sponsoring members of the National Cancer Policy Forum through the National Academies of Science, Engineering, and Medicine. And this forum serves as a trusted venue to identify high priority policy issues in cancer research and care, and works to examine those issues and identify policy solutions for federal lawmakers and agencies to implement. ONS members have served as members of this forum, and ONS routinely participates in this forum's workshops to ensure the voices of oncology nurses are heard. We are the only organization to represent nursing in this initiative. And over its 50-year history, ONS has published many position statements that set the standard and push the boundaries for best practices in cancer care, prevention, and research. These position statements provide a powerful and trusted voice to policymakers at the local, state, and federal level to ensure that high-quality care is provided to all people with cancer. And you actually can view all of our current position statements on the ONS website, which we have linked in the episode notes. Although there are many other examples, I would like to highlight ONS's active participation and leadership within several of our coalitions, such as the APRN Roundtable, the Campaign for Tobacco-Free Kids, the National Patient Advocacy Foundation, One Voice Against Cancer, and the Patient Quality of Life Coalition. ONS has been an ally and a partner in a wide range of coalitions over the years and has helped solidify ONS as a leading voice in policy and advocacy now and in the future. And we should all be so proud of that history. Let's think a little bit more about kind of the pressing challenges today as we think about the landscape. From your point of view, what might be some of those most pressing current challenges that oncology nurses are facing in their efforts to advocate for both equitable and quality cancer care, especially for underrepresented communities? Janice, do you want to start?
I think that there are so many pressing issues, but I'm going to start with any kind of threats or legislation that's poised to take away safety net resources. It's really going to set us back because we all know that, particularly for minorities and certain other underserved populations, they have experienced poor cancer outcomes for a variety of reasons, variety of socioeconomic reasons, lack of access to quality screening resources, you name it. When you take away those safety net resources and take away resources for people who are already underserved, uninsured, or underinsured, it also jeopardizes their ability to get proper screening, get proper follow-up, have access to state-of-the-art cancer services. I think the lack of affordability of healthcare is a problem that continues to challenge us. Whether you're on Medicaid or you have limited insurance or what have you, if you don't have that as a base, you might not even want to even go to an ER. You won't get the kind of care that you need if you did go to the ER. But certainly if you didn't have access to affordable, accessible healthcare, where can you go to get baseline primary care, to get the education, the counseling that you need, to get the recommendations and the referrals for the screening that you need? If we're going to focus on prevention and earlier detection, if people don't have access to affordable health care, that also interferes with their ability to have what they need to be screened at an earlier stage, or even to be educated about how to mitigate their risk in terms of cancer. And I think another pressing challenge that oncology nurses will face is when we find things like the dismantling of CDC, which we know has been a long-term, well-respected source of evidence-based information for providers, for patients and consumers. It's very, very troubling. We see that happening now. And other organizations are scrambling to try to figure out where can they go to get credible information. We also see threats to NIH funding, which also interferes with advancements in cancer research. So we really have our work cut out for us. And so as we shape our advocacy agenda, I'm hoping that we can take these things to heart and make these a part of our advocacy efforts.
Thank you so much for kind of setting the stage there and thinking about some of the things that are kind of swirling around in today's world. For our listeners, if this is relevant, today is October 7th, 2025. So many things change quickly. And so we just want to set the tone for where we are today. Barbara, would you have anything else to add or offer?
Definitely. And I totally agree with everything that Janice said. We have some really pressing current challenges right now. I mean, we could talk about lots of them. Janice did a great job articulating three of these highest ones, but I want to augment on that and add to that. So I think equally important is the fact that we as oncology nurses must become really the most skilled group in knowing how to truly successfully advocate. If we're going to help get these changes made that need to be happening at federal level, sometimes our state levels and other places, we need to be really skilled at knowing how to be advocates. ONS has been very pivotal in working with oncology nurses on that. But I see that as a current challenge as well. I ran our PhD program at the University of New Mexico and still teach the PhD program. And it's constantly, and I taught all the health policy for all of our PhD program students, mainly nurses, but people from other disciplines as well. And it continues to be striking to me how many well-educated people don't have a clue about how to go about policy level changes that need to be made. So I think this lack of knowledge on how to really successfully advocate is also a pressing challenge for us internally. Also, understanding the juxtaposition of politics and policy. All policy has politics in it. And we need to have ongoing connections at state, federal, county levels. Having worked in the United States Senate as part of the Robert Wood Johnson Foundation, National Academy of Medicine, Health Policy Fellowship, taught me much about this because when I would see nursing groups come to advocate to us, I was helping staff the Senate Health Committee, Health, Education, Labor, and Pensions. The nurses were so well-intentioned, but didn't really have all the skills about how to really portray the point and what are the solutions that can happen. I've also worked for the legislature in both Texas and New Mexico, as well as the executive branch in New Mexico. And again, spent lots of my time teaching nurses how we can make these changes. We see the challenges. We see what we're concerned about, and we're worried about that, how it impacts us, how it impacts our patients. But we need to be able to be the leaders in making these changes. And there's opportunities right now with some of the changes that are happening in our country, the rising cost of healthcare and how unaffordable it is for the quality that is received from that, all kinds of aspects we can mention here, as Janice has done such a great job of doing. But I just want to stress that in addition to those challenges we see out there in the world, let's look internally and how can we meet our own internal challenges to become very strong advocates for getting the right policy in place.
That's absolutely spot on. I couldn't agree more with those sentiments. ONS has been engaged in successful nonpartisan and bipartisan advocacy efforts over the past several decades. And I'm wondering if you could share a brief example or two of the past advocacy work you've done with ONS that has had some major impacts. Barbara, do you want to start?
Yeah, a couple of examples I'll give here. As I mentioned, I worked for the United States Senate Health Committee when I was a health policy fellow there with the Robert Wood Johnson Foundation, National Academy of Medicine. And I connected with ONS frequently during the year plus that I was there in Washington, D.C. Worked with certain bills that I was working on. For example, I worked on the compounded pharmacy bills and connected with ONS to make sure. One example I do like to give frequently on that bill, this was before any compounded pharmacies were regulated. This was back in 2012 and 2013. There's a big case in Tennessee at the time of some bad effects that had come from some medicine from a compounding pharmacy in Tennessee. So I worked in a very bipartisan manner. At that point, there was really great bipartisan work with Democrats and Republicans from the Health Committee on language for getting this compounding pharmacy bill, which is now statute with that. But I knew how much oncology advanced practice nurses prescribed drugs that weren't involved in compounding pharmacy. So working with ONS at that time, as well as many other entities, I was able to get language into that bill that referenced healthcare providers. The bill was originally just going to say only physicians who are prescribing medications through a compounding pharmacy. And I was able to get wording that was healthcare providers that included all advanced practice nurses who had prescription authority. So that was a way that working with ONS staff and others at the time to help me come up with what are the words we want to put in there, how do we want to work with that. Another example I want to give with Janice and I could both talk a lot about our Hill visits with ONS and ACS. While I worked with the legislature, both Texas and New Mexico, I constantly was working with ONS advocacy staff and other members to make sure that the bills that were important to oncology nurses at both state and federal levels are being heard. And without such a strong, robust, well-respected professional organization like ONS, we wouldn't have some of the strong bills we have had that state levels that dealt with screening. For example, I dealt with bills for breast cancer screening in underserved populations in our Hispanic and Native American populations here in New Mexico. But because ONS is so grounded in science and research as well, we're not just a clinical organization. We're grounded in scholarship, science, research, and publication. So we're able to take this vast network of strong clinicians combined with the amazing scientists like Janice mentioned earlier, when we've had some amazing scientists come out of ONS. Some of the leading nurse scientists of all time were also oncology nurses. So by combining this, we're able to make a difference at the state and federal level. So the advocacy work that I've been involved in at state and federal level is really involved working with the ONS staff involved with advocacy and those scientists and clinicians who brought that expertise.
That's awesome. Really great examples. I like that compounding pharmacy bill and the nuances of language. And had a nurse not been there to help legislators understand the nuances of and the differences between physician and healthcare providers, that's a really, really great example. So thanks for sharing that and the others. Janice, do you have anything else to add?
I would say that some of my most productive, impressive preparation and development, again, came from my affiliation with the Oncology Nursing Society in Chicago many, many years ago. When I started doing my volunteer work and I became a member of ONS, I relied very heavily on some of the resources that ONS provided to help me inform and to actually conduct my own breast cancer disparities work. That foundation also helped me to land position with Susan G. Komen affiliate in Chicago, serving as their chair of public policy, something that I never, ever would have thought that I would be qualified for. But because I had some beginning preparations, thanks to ONS, I was able to serve as policy chair for a little bit. That also laid the foundation for my application with the Robert Wood Johnson's Health Policy Fellows Program. Barbara and I both served in that capacity. I was blessed to become a fellow in 2010. Again, I had a foundation that I had started out with the Oncology Nursing Society. I had some other experiences through volunteerism, but the fellowship, as you know, is very, very competitive. And so having some really stellar experiences made me, I think, a stronger applicant. I was fortunate enough to be selected, and I worked in Senator Rockefeller's office, where I worked on prescription drug abuse and very broad aspects of the Affordable Care Act. So I say all that to say that my foundation was strong going into the policy fellowship. Sure, there was a lot more that I needed to learn, but thanks to some of my volunteerism and some of my work and preparation through my affiliation with ONS, I was able to successfully compete for a slot in the fellowship. I also want to just say that I represented the Oncology Nursing Society at the nurse internship in Washington. That was prior to the Robert Wood Johnson's Health Policy Fellowship. And that's when I really got the policy bug, because I was introduced to those health policy concepts, and I really hadn't really thought that much of policy in terms of my own clinical practice and research. But thankfully, over the years, I've been able to make the connections. There's a very strong connection between clinical practice, research, and policy. And it's only when you take a deep dive into that and you're exposed to policy concepts and principles, and then you see it in real action, can you really, really make some sense of that. And I just want to thank Alex Stone for making sure that I was always involved. And he always made sure that even after I had moved on from being really, really involved with the society, he still made sure that I was kept in the loop with very important information, alerts, and things like that. He even came to visit me at the medical center once to talk to the staff nurses, because we were launching a legislative committee and we wanted to speak to the experts who had done such great advocacy work with nurses. And so I'm grateful for him and his mentorship over the years.
Yes, we all love Alec. And you said, you caught the policy bug. I can totally relate to that. And ONS being the place where that bug kind of emerged. And I think that's true for so many of our listeners and those that have been involved in some of the advocacy work through ONS, through Hill Days and other activities. As we look to the future, what do you think the Oncology Nursing Society community and oncology nurses more broadly need to do to sustain these efforts as we look forward to the next 50 years and beyond? Janice, do you want to start?
I would say continue investing in nursing development across the entire cancer continuum. And I just want to echo what Dr. Damron said in terms of making sure that nurses are well prepared to be strong advocates. We've already laid a great foundation for that, and continuing to invest in that. Continue to support ONS scholarships. Maybe there needs to be something that's specifically devoted to policy. That should be pretty exciting and interesting. I think expanding the work around multiculturalism in oncology will always be important. Are there any new partnerships or avenues that ONS can reach out to or explore? Maybe there are other specialty organizations or groups, and not always necessarily nursing, because as we think about the determinants of health, we think about things like health and all policies. Maybe there are other disciplines or other specialties that we need to embrace as we launch our agendas. Be very, very intentional about recruiting this next generation for a specialty which is so demanding as oncology. I think that's a very unique specialty. I think all of nursing is unique, but oncology is extremely unique. And we need some very unique, dedicated, compassionate people. And then I would say for graduate students, how can students get more involved in making the connection between policy and research? I've been telling some of my mentees, when they read an article, are there policy implications that are indicated in the article? When they write their dissertations or they write their papers, are they thinking about policy implications? So helping our graduate students to conduct health policy research and understanding the connectivity between their specialty and cancer health policy, I think will continue to be a priority for our organization.
Barbara, what thoughts do you have?
Yes, again, I agree with what Janice has said. And a couple other thoughts with that. I think ONS, we can really even be more intentional about training nurses about the intersection of politics and policy. We do look at things in a bipartisan way and many times a nonpartisan way. That's one of the strengths of ONS. But we need to understand how politics work, not just all the theory that's out there about politics, but how it works in today's world, that intersection. For example, having served as cabinet secretary for higher education for the state of New Mexico, I was the only secretary that 100% of my priority bills passed. I worked for a Republican governor with a fully Democrat legislature, yet 100% of my bills passed. And that was because I understood that intersection of politics and policy I really learned from my years with ONS. I think we also need to be very intentional about how to train nurses on how to be effective advocates. There are skill sets associated with that. It's not just having compassion, which is important. It's not just being caring about our patients, but there are skills associated with that I think we really need to continue training our nurses with that. I think we really need to push more of our oncology nurses to get into elected and appointed positions. I was appointed into my HED, Higher Education Department Cabinet Secretary role, but I also had to be confirmed by the Senate. And this is in higher education. It wasn't in health. So often we're looking at health positions to get involved, and those are wonderful. We need nurses as secretaries of health and many of the legislative committees that deal with health and such. But there are others. We as nurses, we understand higher education. We understand environment. We understand energy. So I think we look broadly at what are positions we can get in. Let's have more nurses run for state legislative offices, for U.S. offices, for our House of Representatives, for the U.S. Senate. Additionally, I'd like to see more nurses, oncology nurses working as registered lobbyists. I was the only in-house registered lobbyist for UNM for several years, and that opened my eyes to a lot. And I continue to bring and call upon that ONS experience I had, both the leadership experience I had. I led a big campaign of raising money years back in the early 2000s. And I tease, if I can get a bunch of oncology nurses to come together and do things, I can get legislators to come together and do things. And many of those same skills came to play with that. So working as a registered lobbyist really gave me an interesting perspective and also gave other lobbyists a perspective on what oncology nurses can do. And lastly, I'll say, for example, now I'm chair of the Western Interstate Commission for Higher Education. Our country has 4 higher education compacts, and I'm the first nurse to ever chair one of these higher education compacts, and I'm chairing the Witchy Compact. But again, that's opportunities for nurses, and I'd like to see oncology nurses in the next 50 years branch out more than just oncology nursing. We can always bring our expertise to that, but that helps people see what oncology nursing can do. Because as we talk frequently, oncology impacts everyone. There's hardly the family or person or community that hasn't been impacted by cancer. And so we're there in so many ways. And it's also such a unique discipline and specialty because we have to be very good scientifically. We have to know physiology as well as psychology and spirituality and other aspects with that. So I think there's lots of opportunities for us in the next 50 years to sustain what we have been doing, but opportunities for us to branch in broader ways than we ever dreamed about.
That's great advice. And so much there that I'm thinking about that you shared. But one obviously really impressive thing is being able to pass all of those pieces of legislation with the split government. That's a testament, of course, to your leadership and skills, but I think also a testament to the skills that us as nurses, as oncology nurses have, and bringing people together, settling differences, centering around a shared vision, a shared understanding of the importance of why this matters. And having those conversations with people are skills that all of us as oncology nurses have, because we are in the spaces where there can be a lot of conflict and are often relied upon to help resolve those conflicts from the micro, macro levels. So really great examples, really great contributions. Janice, what else would you like to add?
I just wanted to piggyback on something that Barbara said in terms of elected and appointed positions. I too have an appointed position appointed by Governor Pritzker to be the assistant director of the Illinois Department of Public Health and also confirmed by the Senate. These are experiences in themselves, I tell you. And I think that for nurses who might be interested in pursuing something like that, I want them to kind of understand that there are some stepping stones before you get there. My stepping stone started with volunteerism, educating myself, serving on committees, serving on things that were not necessarily nursing, but sitting on committees that I could lend a nursing perspective. And so I think ONS, if they could maybe highlight these accomplishments of nurses who have taken on some of their trainings and education and connections and how they have leveraged those experiences to get to where they are now, might be encouraging to other nurses who want to take this to the next level.
If I could just jump on that, I agree with what Janice was saying and what you said as well, Ryne, because as nurses, just our basic nursing training, we get these skills. We see a problem, we identify the problem, we assess what we're going to do about it, we do it, and then we evaluate what we did. Does that work or not? That's how you make policy. So, I mean, we're all trained in this. Then you bring on top of that our oncology nursing experience, whether it's clinical, whether it's research, all the different, whether it's teaching, practice, et cetera. Those continue to refine those skills that are basic to us as nursing. And so I agree, because we have this built-in skill set and we need to own it and understand it. We also need to be very knowledgeable and do the stepping stones, like Janice is saying. I too was appointed by a governor, and that just doesn't happen. I too had volunteered with work, and I'm an independent, so both parties I've volunteered and worked with. But there's stepping stones to that, getting to know the system, getting people to know you, getting involved, seeing that they see you as a doer. And that just comes naturally to us as oncology nurses. We are doers. We identify the problems, we get them done. We admit when something we did didn't work, and look how we can refine that. So I just think there's so much opportunity for oncology nurses going forward. And ONS provides so much of this leadership opportunities and relationship building and an opportunity to advocate. And if you don't know how to do it, we're here to teach you through ONS. We're here to show you how to make your visits on the Hill, how to even do that in your state. So I tell every new nurse I know, whether it's in oncology or not, to get involved in a professional organization. But the best one to get involved with is ONS, because what they will learn from ONS will be way beyond their clinical skills.
Absolutely. Really great call to action from both of you. And I hear themes of mentorship. I hear themes of showing up, saying yes, believing in yourself, not waiting for permission. These are all really great pearls of wisdom that you both have shared with our listeners today as we think about the next 50 years of impact and building on the tremendous legacy that ONS has made and has laid for those to come, and all on behalf of people with cancer and the people who care for them. That's our driving mission. That's what keeps us motivated to keep showing up and doing this really hard work every time. As we celebrate 50 years of the Oncology Nursing Society, we honor the countless nurses who have turned advocacy into action, shaping policy, advancing research, and ensuring better care for every person facing cancer. The milestones we've highlighted today are just the beginning. With the power of our collective voice, the next 50 years hold even greater promise for oncology nursing and the patients we serve. I want to thank you all for joining us today and for being a part of this ongoing story of impact and change. A particular thank you to both Dr. Phillips and Dr. Damron for joining me today. It's a great privilege to be able to have this conversation with both of you. Such legacy and members for us at ONS. So congratulations, ONS.
Thank you so much.
Congratulations and thank you.
Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.